Welcome to another European Voice Health Check. We're delighted to see you here to share in this exploration of how well Europe is meeting the challenge of multi-drug resistant tuberculosis.
This is really a ticking time bomb. Treatment success in MDR-TB is only in 64% reached, and in XDR-TB it's only in 40%.
If you get hit by one of these, your best hope is a frighteningly uncomfortable treatment lasting 2 years or more, and the chances of you surviving are not very high. Modern diagnostics are still not widely used. Any effective new vaccine is at least a decade away, disease monitoring is still imperfect, and treatment programs are under strain. So the solution depends on greater collaboration.
The situation in Europe with regards to tuberculosis is unacceptable. Our region is considered as too rich to be benefiting from international aid. Isn't it shocking that, for instance, if you have drug-resistant tuberculosis, you have 3 times more chances of getting cured if you live in the Democratic Republic of Congo than if you live in Bulgaria? Some countries cannot effectively tackle the epidemic on their own. The TB has become a cross-border health threat that needs a regional solution.
TB and MDR-TB highly impact the productivity of work that can be translated in not less than 5.3 billion euros lost in 2011 in the EU due to ill health, disability or early death.
We need new drugs to treat TB. We also need better vaccines. We need to deal with the problem of antimicrobial resistance, not just by pumping money into research, but also by addressing the business model failures. What is the incentive for industry to come up with, to invest in research?
It is crucial that the development of medicines, vaccines, and diagnostic tools is health needs driven and not market driven.
The truth is that science takes a long time. We have to prepare a health system that is able to both manage these technologies, but also think about how to have specific national strategies. You know, there are plenty of countries that are doing very well in the area of tuberculosis. Or is it actually that there are focused national strategies and leadership, dedicated public health infrastructure, and broad-based programs, not around products, but around screening, diagnosis, and appropriate treatment?
1,000 people per day get TB in Europe. Because if you do not invest now, you will have to invest much more in the future, which we cannot afford again in a vertical approach. And I think the added value of EU here is to make sure that there is exchange of experiences between the countries. What we also did to look at the best practices, not to say what is not working, but also to say what is working.
It requires acting together.
And it will need a concerted effort. It will need collaboration.